Recording in progress.
Noundar. Good afternoon. My name is Councillor Sue Shotter and I am the Chair of the Social Care and Health Overview and Scrutiny Committee. Can I welcome everyone to the meeting, which is a multi-location meeting. The meeting will be live streamed and recorded and will be available for viewing after the meeting. Should the live streaming fail, the meeting will continue and a recording will be available through the Council's website following the conclusion of the meeting. Can I remind members that translation facilities are available, and for those attending remotely to choose your language of choice, please. For those wishing to speak in the chamber, please raise your hand. For those attending remotely, please use the raise hand function. We will alternate between speakers in the chamber and remote attendees. For those attending remotely, please note that those in the chamber will be enabled to use the chat facilities. Committee members who attend remotely are required to leave the cameras on through the debate and when voting in order to maintain the integrity of the decision-making process. If you do need to leave the meeting temporarily, pop a message in the chat box so the Democratic Service Officer is aware and then let us know when you return. I expect everyone present and participating in this meeting to conduct themselves appropriately and be respectful to each other. That applies to members, officers, and anyone in the public gallery. When I open up the debate to members, I will ask the committee members to speak first and put their questions first, following non-committee members. While I do not wish to stifle debate, can I remind members that any questions should be focused on the subject matter and thus avoid repetition. If I feel the length of an individual's speeches are negative, impacting on the overall time for discussion and becoming unmanageable, I will defer to the committee rules of procedure. Onto the agenda item. Committee Services Officer Jane Jones, are there any apologies for absences?
Yes, from Councillors Mandy Hawkins, Dave Jones, Paul Lecoq and the Strategic Director Jenny Williams.
Thank you very much. Declaration of Interest, Code of Local Government Conduct. Members are reminded that they must declare the existence and nature of the declared personal interest. Any declarations, members? No. Thank you. Any urgent matters, Jane?
No urgent matters.
Thank you. Agenda item 4, to approve and sign as correct record the minutes of the previous meeting held on the 15th of the 2nd, 23. Pages 3 to 11. We will take the pages individually for accuracy, please. 3, 4, 5, 6, 7, 8, 9, 10 and 11. Is there a proposal that these are a true record? Councillor Abdul. Is there a seconder? Councillor David. Members, if you can show by the raise of your hands to approve the minutes in the chamber and on Zoom. Are there any against and any abstaining? That's been passed. Agenda item 5, to review the forward work programme of the Social Care and Health Overview and Scrutiny Committee. Forward work programme pages 12 to 16 and the combined work programme pages 17 to 45. Dawn Hughes, Scrutiny and Committee Service Officer, will present this item. Thank you, Dawn.
Thank you, Chair. So just a couple of items for members. So as I'm sure you're aware now, I'm currently in the process of devising draft forward work programmes for all the scrutiny committees for this coming municipal year, with the chairs and vice chairs and heads of service. So I will be emailing members of the committee shortly with the draft forward plan for social care, asking if you have any further items you wish to see on the forward plan, but obviously this will be subject to you completing a necessary scrutiny topic form and that obviously meeting the criteria. Also, in relation to the item on the forward plan on the Audit Wales reports on social services, that's due to go to the June meeting. The head of Integrated Adult Services, Kat, she's here, has advised that the actions in the Audit Wales reports are assigned to the Regional Partnership Board and Welsh Government respectively to deliver the actions, and as such Conway does not have any action to deliver itself. Therefore, there's a request that this item be removed for now as there's nothing to report on, and it be monitored through Partnership Working and Audit Wales. And obviously the head of service will escalate any issues as necessary.
Thank you, Dawn. Thank you very much. Is there a proposer? Councillor Dave and a seconder. Thank you. Okay, members, can I now ask us to take a vote by the show of hands on Zoom and in the chamber, please? And is there anybody against that? No. Okay, that's been carried, members. Agenda item 6, questions to cabinet members. Jane, are there any questions?
No questions, Chair.
Okay, we move on to agenda item 7.1 to consider a report by the Strategic Director of Social Care and Education on the following matters. Mwynhau di Geriau, More Than Just Words, 5-year plan 2022 to 2027, progress report on pages 46 to 55. Recommendations can be found on pages 47. There are options which can be found on pages 47 and 48, and there is a risk implication which can be found on pages 49. The report will be introduced by our portfolio holder, Councillor Liz Roberts, Cabinet Member for Children, Families and Safeguarding, and Councillor Penny Ando, Cabinet Member for Integrated Adults and Community Services. Mark Rowley, Workforce Manager, will provide the details. This item was requested originally by Councillor Aaron. Diolch, Councillor Aaron. Diolch, Councillor Liz and Penny. The stage is yours.
Diolch yn fawr iawn, Cadeirydd. Dwi'n mynd I siarad yn Gymraeg.
I'm going to speak in Welsh. I'm pleased to report to you this afternoon the progress report on the 5-year report, More Than Words, 2022 to 2027. The order of the report, Mark Rowley is here online this afternoon. Mark will go through the report in more detail. Can I thank Councillor Aaron Wynne, as the Chair has already done, to make a request through the correct channels, the topic selection form, requesting this report to be presented to the Councillor today. The purpose of the report is to provide the update on the social care and education service in relation to the More Than Just Words 5-year action plan. This is the Welsh Government strategic framework to provide Welsh language within social care and health. The aim is to support Welsh speakers to receive services in their first language. The scheme is based on the following: culture and leadership, planning and Welsh language policy, supporting and developing Welsh language skills of the workforce, sharing best practice and developing and enabling approach. The steering group has been established to look at the scheme. The intention of the group is to be inclusive and enthusiastic towards the Welsh language in More Than Just Words. After establishing a draft action plan, Appendix 1 in the pack, the group will hold consultation workshops for enabling opportunity to contribute to the action plan. As I've shared in the report, effective communication in the language choice of the individual, particularly within social care, is essential. The scheme goes beyond complying with the Welsh language standards. It encourages the use of Welsh during assessment and discussion. We wish to offer consistency and quality through the Welsh language. The recommendation this afternoon in the report is that the members accept the reports and the proposed action plan. And Councillor Penny is online if Penny wants to say a word before we go on to Mark Crowley. Thank you very much.
Councillors, and thank you everybody. This is a very welcome report, and I'll hand straight over to Mark, who's going to talk us through it, and we can see the progress report in the next couple of years. Thank you very much.
Pnawn da, everybody. I'm Mark Crowley, Workforce Manager for Conway Social Care and Education. And that was a really good introduction and covered most of what is in the report before elected members. I just want to add a bit more detail and give a legal context to this work. We do have the More Than Just Words framework, which is a 5-year framework for health and social care. But underpinning that work is also the Social Services and Wellbeing Act. And part 3 of the Code of Practice of the Act, which is around assessing the needs of individuals, it requires assessments of needs of that individual to recognise the concept of language need. And practitioners should ensure that the active offer, what the active offer is, it's that proactive approach to offering a service in the language of choice. And what the Act requires of us is that it's a principle and that it's embedded into day-to-day practice. And that means that the active offer, the service is offered in Welsh, and it's not reliant upon the person receiving the service asking for a service in Welsh. As the elected members have said, our portfolio holders, we established a steering group in December last year to look at implementing the framework and not losing sight that it is a 5-year framework. And really the purpose of the steering group is to embed the framework into practice. And to do that, what we've done is actually review our current practice against the framework and identified areas that we know we need to improve upon. But as was touched upon by Councillor Liz, we want to take a really inclusive approach. There's a lot of energy within the steering group. And the approach we want to take is to actually involve staff, our managers, but also the services that we commission, because the More Than Just Words framework also applies to commissioned services. And it places a responsibility on us when we're commissioning services to ensure that commissioned services are working to the More Than Just Words framework. So the actions that we're taking is that, yes, we have a draft action plan, but that will not be signed off until we've completed 3 workshops that are taking place in June and early July. The 3 workshops, we're commissioning an organisation called Iaith to deliver the workshops, and 1 workshop will be for managers in social care. And that's linking into the cross-cutting theme within More Than Just Words framework around leadership, where there's an expectation that leadership within social care organisation takes a drive towards implementing More Than Just Words. So 1 workshop will be for managers, the 2nd workshop will be for staff, and the 3rd workshop will be for commissioned services. The purpose of those workshops is to develop an action plan that everybody recognises that they've had input into, and which means then that the action plan is not owned by the steering group, it's owned by staff, managers and commissioned services. And then the role of the steering group will be to implement the action plan. I think just to give a little context, because sometimes as workforce manager, I'm asked questions around, does the advertisement of posts where Welsh is essential, is that a blockage to recruitment? I would say I have no evidence of that. I mean, currently we've got about 60 vacant posts within social care, of which 5 are essential. We have difficulties recruiting to all posts, irrespective of whether it's Welsh essential or not Welsh essential. And just to give a bit more context to our own workforce, around 28% of our staff have the ability to speak Welsh at level 2 or above. And I think the last figures I saw for Conway population from the census was around 25%. So it's important that we maintain that and go beyond that. I'm not sure that there's a lot more detail I can add, because I think the report is brief because it is only early days of the steering group, and it's not until the final action plan is signed off would we have something to then further report on. And we have discussed coming back to this committee in late autumn to report on the signed off action plan and how we're going about implementing the action plan. So I'll conclude there, but I'm happy to take any questions from members. Diolch.
Thank you very much. Diolch, Mark. Any question made? Councillor Austin, I apologise.
Diolch yn fawr, Madam Cadeirydd.
Thank you, Chair. I haven't got any questions. I would like to thank everyone involved with the report. It's a report to be welcomed. Can I personally thank Councillor Aaron Wynne for requesting this report? Can I also thank the two Cabinet members, Councillor Liz and Councillor Penny, for their work and for supporting this report. As someone as a Welsh speaker in a fairly Welsh community, what people don't understand is, yes, there isn't such a thing as a Welsh only speaker, although I remember the days when there was. What I'm trying to say, as you're getting older, and particularly if you suffer with dementia, which what happens is you go back to your mother tongue. And I had an experience of that with my mother. So it is important that we do try our best to provide care for these people in their mother tongue. So I welcome this, and I'm happy to report that we note this report. Thank you.
Diolch yn fawr, Austin. Any other members? Anybody on Zoom? Okay, members. Oh, Councillor Aaron.
Diolch yn fawr iawn, Cadeirydd.
Thank you, Chair. And thank you for allowing me to speak, as I am not a member of this committee. I am pleased that this report has been presented to members today. I think it's very important that people do have access to health services, primary and secondary care in their first language, particularly vulnerable and older people. I'm pleased that there are actions and clear commitments in the action plan to really create a bilingual service. I'm also pleased that there is mention about encouraging staff to learn Welsh. In reality, that is the only way of creating a bilingual workforce. And a number of members of staff in the council have proven that there's an ability to learn this skill of learning Welsh. So can I thank councillors Liz and Penny, and thanks to Mark for taking us through the report. Thank you.
Diolch, Councillor Aaron. Sorry, it's I keep on getting feedback off my hearing. Okay. Do we have any more questions? No, then Councillor Austin, are you proposing that we take option 1, which is the report recommendation is accepted? Do we have a seconder for that? Okay, Councillor Sean. Members, the recommendation is that members receive the report and that they are assured by the action plan. Would it be okay, Jane, if I take this on as one complete, or would you like me to ask the members to vote on the first, the option 1? Okay. Okay, members, we're voting on the action plan. So we have a proposer, which is Councillor Austin, and a seconder, Councillor Sean. If all members in the chamber and on Zoom could show support by raising of the hands. That looks like it's been passed. Is there anybody that is against or abstaining? Okay, members, that has been passed. Thank you very much. Next agenda item is 7.2, the Joint Conwy and Denbighshire Joint Adoption Panel Annual Report. This annual report can be found on pages 56 to 123. Recommendations can be found on pages 56, and there again is a risk implication which can be found on page 65. Cabinet members, Councillor Penny and Councillor Liz will be introducing this agenda item. Tesney Howden, Interim Head of Children, Families and Safeguarding, and Kathy Mackenzie, Interim Service Manager for the Looked After Children, will provide the details. Diolch, Councillor Liz and Councillor Penny. Croeso.
Annual report 2021-22 is to provide members with information about the activity of the panel between the 1st of April 2021, as I just said, and 31st of March 2022, and to note the developments within the Regional Adoption Service during the reporting period. So the purpose of the Adoption Register for Wales is to minimise delay in finding adoptive families for children who are waiting to be matched, and is a further step in the Welsh Government strategy to improve outcomes for children across Wales and help deliver the National Adoption Service priority to match and place children effectively. When it was created in 2016, the expectation was that children's names were placed on the Adoption Register for Wales, and if not linked to prospective adopters by 3 months, this was reduced to 1 month in October 2019. Whilst the principle behind this directive is clear, in order to ensure children do not wait for adopters for longer than necessary, it does not allow much time for the North Wales Adoption Service to consider a potential match. If there is a potential match identified, however, then the referral to the register can be suspended. And then NB, referral to the register does not mean that NWAS matches cannot be made, but if a match is found outside of NWAS, it is likely to be accepted rather than risk delays for the child. Now, Kathy will expand more on that aspect for members. So the composition of the panel and activity. The membership of the panel consists of the following 12 members with equal representation from Conwy and Denbighshire. So we have the chairperson, who's independently appointed, 2 medical advisors, one from Conwy and Denbighshire, and they share a vote, 2 social workers, one with Conwy childcare background and one with a Denbighshire family placement background, and a maximum 5 independent members across the 2 authorities, and 2 elected members, one from Conwy and one from Denbighshire. And Councillor Sherrill is the elected member from Conwy, and I'd like to thank Councillor Sherrill for her work on this panel that she has done now for a number of years. The following attend panel, but do not have voting rights. So there's the panel advisor and the legal advisor. Conwy and Denbighshire legal advisors rotate on a 6-monthly basis, and the panel administrator. So this report in the main is to share and update members the performance and effectiveness of the joint Conwy and Denbighshire adoption panel. And in my comments, I quote in the report, "It is pleasing to note the promising data within the report which demonstrates the effectiveness of the service delivery despite the challenges of the COVID-19 pandemic, which forced different ways of working. And I know that from when I sat on the fostering panel. Albeit these challenges, the report notes the presentation to panel to be of high, robust quality assessments by NWAS social workers, which ultimately ensures that robust decisions are made from evidence-based discussion. Imperative when panel are considering placement of child or children with adoptive parents. So the recommendations are at 2.1 and 2.2 of the report. So I would like to hand over now to Kathy, who will share in more detail with you the finer aspects of the report. So thanks very much indeed, Kathy.
Could you put your, thank you very much.
There you go. Diolch yn fawr.
So just to put this in the context, previous to the partnership, Conway we provided the adoption service for Conway, and obviously some years ago we recognised the constraints of that and started to work in the partnership to increase our opportunities to find prospective adopters. As you can imagine, adopters are very unique people and very specialist in their area. So to take a child into your home and to commit to looking after that child for life, it is certainly something very special. But the process of matching children to the correct adoptive parents is a very specialist area. So Conway made the decision some years ago that we would enter the partnership. When there are difficulties in finding placements for young children, when we would have to look to some of the private adopting agencies, and certainly being part of the partnership, as you can see from the report, has started to decrease significantly the amount of times that we have to do that. So I'll just take you through some of the highlights of the report, really. On 3.2.2, 45 children across North Wales were referred to at NWAS. But 19 of those children didn't have an identified link in this reporting period. But just to put that in context, one of them was a family group sibling of 5, and the others, again, some of those children were referred towards the end of the reporting period, and obviously it takes some time. So in Conway, 7 children were matched for adoption, and 5 of those children were placed through NWAS. And on this particular reporting period, we had to go to the private agency twice. Now, going to the private adopting agency costs us quite significant amounts of money. So again, it's really important that we stay part of the partnership to enable young people to stay in Wales. Within NWAS, the number of approvals of adopters has remained the same this year as last year, which is 23 approvals during 21-22 and 23 during this reporting period. Where we can't, what we actually do now, where we can't find a match within the North Wales, we now are able to place somebody on the register for the all Wales, and we do that quite promptly now. It used to be 3 months, it's within 1 month, and I think you took us through that process. But the financial implications for local authorities placing children outside of North Wales have been significant. It's £32,320 per child, and in this reporting period we did have to do that twice. But years before we were placing I think it's 10 children the year before. On 3.3.1, 2018, yes, sorry, it did say that we required 10 of those placements. The National Adoption Service annual review report has been attached, so that if you need any further information, you'll be able to look at those details. So I'm on, sorry, I've lost my paragraph. So on 3.4.3, just to bring to your attention that the service not only provides that matching service, but it also provides support services for adopters. As part of NWAS, we've got 3 therapeutic workers working with families pre and post adoption. This has been a new service and it's still really developing, and it's really to prevent adoption breakdown. And they're working particularly well supporting families and implementing therapeutic parenting really across Wales and for our adopted families.
We've got a new worker recruited to the Connected Persons post, offering peer and support and youth groups to adopted children, which is really nice, so that the children have very unique experiences, and it's really important for them to share with other children who have been adopted, because they really need to understand their uniqueness. So that connected post keeps those children connected to each other as well. On 3.5.1, there were 11 panel meetings in the year April 21 to March, and the attendance is really, really good. No meetings were cancelled due to lack of quorum, which is shows the commitment really of that panel. They have 75%. The attendance of most members is really high, well above the 75% that you would expect. And I know certainly that you know, the panel members are really committed, and it's not just turning up to a panel. It can take 2 to 3 hours to get through each pack. Sometimes it can take days with the detail, because you have to understand all the detail of the child's needs and to understand how those families can be there. So the panel who meet really give us, you know, work exceptionally hard to get this matching right and to get the adoptions through. The panel members performed well in 21-22, with everyone fully engaged in the discussion and contributing to the recommendations. And members agreed that the documentation presented to them by the social workers was a really high standard. And again, that's some of the benefits to being part of the partnership, because these workers are highly specialist. They're doing this day in, day out. In terms of our engagement, formal engagement has taken place during the reporting period. During the panel members' annual reviews, and they have peer reviews, which were held in May and June. The NWAS annual performance report on the quality of the services provided is attached for you to have a look at. And general feedback from this report is that the creation of a full-time service lead, which was filled permanently during this period, has led to increased capacity to attend regional and national meetings. The management structure of the 3 practice managers remains in place within the service. I think that concludes my report. I did put some of the figures just for you, just for information. Conway contributes 284,000 towards NWAS, and for that we have 2 social workers, a panel administrator and a team manager, and it covers the cost of the panel members and the regular panels that meet.
Thank you very much, Kathy.
Thank you.
Are there any questions, members? Doesn't look like that. Councillor Sherrill. Welcome, Councillor Sherrill.
Thanks very much, Chair. That's great. I'd just like to thank Liz for her kind words and say a big thanks to everybody who carries out this vital work. I've done this for, I think it's nearly 16 years now. And as Kathy touched on, I think the reading for these panels can run into days, highly emotional but so rewarding, unbelievable. It's the most important function we carry out, isn't it? This as corporate parents and as an authority, you know, placing a child for the rest of their lives. I think it was 2012, Kathy, that we merged with Denbighshire, if I remember rightly. Just a quick point, you'll see from my comments that I'm concerned about the Welsh Government directive that puts this massive financial pressure on Conway, £32,320 if we don't match the children within 1 month. And I continue to say that we should be constantly telling Welsh Government that it's about the quality, not the quick turnover and time. It's all about the right match for this child for the rest of their lives. Whenever I'm doing this in panel, I always imagine the young person turning up and knocking on my door and asking, you know, why did you make this decision all those years ago? And I always want to be right in my head that we do the right thing. Kathy touched on standards. Conway's reports are always of the highest quality when they come, and I'm extremely proud to represent Conway on the panel. I'd also like to thank Kerry Williams in this, the legal advisor, for well, it must be about 15 years, isn't it, Liz? I'd say must be, who provides first-class legal advice in all the technicalities. So really, just to say, I'll always keep the focus of the panel and Conway Services onto the needs of the child and continue to give my best for this. And thank you to Kathy and Tesney for all their work on this and the support they and their teams do. Absolutely invaluable. Thanks, guys.
Thank you very much, Councillor Sherrill. Very wise and experienced words there. Any other questions, members? Okay, I think we can go forward then to a proposer for this report, and I'll just read what the report is. There's 2 recommendations and they can be found on pages 56, 2.1, that members note the activities of the Joint Conway and Denbighshire Adoptive Panel and the financial impact of referrals to the Adoption Register for Wales and subsequently adoptive placement made outside NWAS. 2.2, that members are provided with a National Adoptive Service Annual Report for 2020 to 2021 for the information and the NWAS Annual Performance Report. Do I have anyone that will propose this? Thank you, Councillor Frank. And do I have a seconder? Councillor Kay? Oh, I apologise, Councillor Frank. My apologies. Please, before we go to the vote.
Thank you, Chair. Chair, I would like to propose that when Councillor Sherrill hits an important point, because in the press, national news, is the people in Wales getting their past apologised to, because somewhere along the line in the 50s, 60s, 70s, the adoption panels got it wrong. This is an excellent report, serious report, because you're dealing with people's lives. Like Cheryl says, you don't want them knocking on your door in 30 years' time, questioning what you did. So I'll move the report, I welcome the report, and I thank everybody involved in it. Thank you, Chair.
Thank you very much, Councillor Frank. Okay, we have a proposer and a seconder for the report and the recommendations on page 56. If I can ask members on Zoom and in the chamber by show of hands to vote. I think that has been unanimously passed. Members, anybody against or abstaining? No. Okay, thank you very much. I think that has been passed. I think that's it. Oh, Councillor Austin, I do apologise.
Thank you, Chair. Just want to make this point. I don't know if the rest of the members of this committee are aware. A member of this committee has been unwell recently, Councillor Paula Cook. So I would like to wish him a speedy recovery. Thank you.
Councillor Austin, I'm sure that we all conclude that we hope he gets better soon. Hope you get better soon, Councillor Paul. Okay, members, can I thank you all for coming today and for participating? Can I also thank the officers, Tesney, Kathy, Kat, and Jane and Dawn. Thank you all very much. And of course, Mark on Zoom. Thank you all very much. Enjoy the rest of your afternoon and we will see you soon.
Bye all.
Thank you, members.